So, ladies and gentlemen, my name is Sharon Whiteman, and I'm one of the team at the Lyme Disease Association of Australia. And it's my great pleasure and privilege to introduce Dr. Bill Rawls this morning, Australia time, but I don't know when you'll be watching this. So, just to give a brief bio, it's pages long, but we're just going to make it short here for purposes of this video. Dr. Bill Rawls is a physician and innovator redefining how we think about chronic illness. After a personal health crisis revealed the limits of conventional medicine, he turned his curiosity towards herbal science and cellular wellness. His research and recovery inspired a new approach that integrates modern biology with the wisdom of nature. Today, through his best-selling books, Vital Plan and Education Outreach, Dr. Rawls helps thousands discover practical, science-based ways to restore resilience and vitality. So, Dr. Rawls, I know it's evening your time. Big warm welcome from Australia. We're very grateful for your time and expertise.
Thank you. Always a pleasure.
Yes, it's so important. We had a brief discussion, and we're pretty medically abandoned right now in Australia in regards to tick-borne diseases and chronic illness, and it's anywhere. And the goal of today would be to educate people and offer them an empowered pathway and to help them understand what they can do to be helping themselves. And I know, in our brief discussion, you said that's the very core. Like we have to dig down and help ourselves. But let's go back to the beginning. So tell us about it. I understand that you discovered that you were sick as well. A physician, you just told me that you a fourth generation physician, and then all of a sudden you found yourself in a bit of a tough spot.
Yeah, yeah, truly. This year, 2025, is a bit of a milestone for me. I graduated from medical school 40 years ago in 1985. And a second milestone, though, is 2005, 20 years ago. I considered the turning point from which I started getting well. And the history in between that was I graduated from medical school and I decided to practice obstetrics and gynecology. So I went for extra training for that, delivering babies, bringing life into the world. It was pretty spectacular. But at that particular point in time, it's gotten better now. I was required to take a hospital call for labor and delivery in the emergency room every second to third night, every second or to third weekend, from Friday till Monday morning. And what that meant is 24 hours, sometimes 36 hours, working all the next day of not sleeping. Between pushing life and keeping up with kids and everything else, I was averaging 4 to 6 hours of sleep a night. And I could do it through my 30s and just push through it. But by my late 40s, my body started breaking down. And one thing that was unique to me, my partners, if someone was in labor, they would go crash in the call room and the nurse would drag them out of bed and they would go deliver the baby. I just couldn't sleep if somebody was labor. I was by their bedside. I just wanted everything to go right. And that taxed my body. Um, so the lack of sleep, and all the other stress that I was carrying, I crashed. Um, I was really forced to stop doing obstetrics kind of right at the peak of my career, which was a real bummer. But I even not doing call anymore, stepping away from obstetrics, but still practicing. I wasn't recovering my sleep, and my whole body just went into a tailspin and started breaking down. I had severe cardiac symptoms. My heart was beating every second to third beat, skipping beats, and I had continual chest pain. I couldn't walk a half mile. I had severe neurological symptoms. I was worked up for MS, but wasn't quite sick enough to have MS, if that sounds familiar to people. Thyroid, some tests said it was a thyroid, others said no. My joints were falling apart. My GI tract was a wreck. My whole body was falling apart. I didn't understand it. And none of my medical colleagues seemed to be able to figure it out either. All they could do is throw drugs at my symptoms. I settled for a diagnosis of fibromyalgia. because just nothing else was quite enough, you know? And I lived like that for several years. Finally, just kept asking that question. It's got to be something. And I didn't have a current tick bite, but like so many people with fibromyalgia, I grew up in the woods getting tick bites. And I thought, could it be this Lyme disease thing? And I
Mm,
finally worked hard, went to a specialty lab, got a positive test, and thought, yeah, this is it. I can take antibiotics and get well. So I took antibiotics and got sicker, and it wrecked my gut. And I tried different antibiotics, and I got sicker, and it wrecked my gut more. And I went round in circles, and I was in a position where financially and covering, the medical practice that I had, by then I had opened a primary care practice just to pay the bills. And so I couldn't really leave town, and finances were tight. I couldn't go to Lyme doctors. I couldn't get any other specialty care out of my community, and that ended up being a blessing because I had to figure the thing out. And by default, with very low expectations, I started using herbal therapy. I read some good content suggesting that herbs have antimicrobial properties, and some herbs, had historically been used for infections. And so I tried an herbal protocol that others were using for Lyme disease, and I started getting better. The surprise was that I thought, well, if it's actually killing the bacteria and that are making me sick, it's also going to wreck my gut like antibiotics. It didn't. My gut got better. And along the way, I changed my diet, I changed my lifestyle, I cleaned up my environment. I did all the things that I needed to do to create an environment that promoted healing inside my body. And over a 5 year period, all the symptoms resolve. The cardiac symptoms, the neurological symptoms, the joints. I thought I'd be having pill replacements by age 60 because my joints were shot at age 50. They healed. They got better.
mm,
I learned that I needed to continue the herbs to keep up with that. And I've now been taking herbs for 20 years. I am 68 years old. I have enjoyed some of the best health that I've had in my entire life over the past 15 years. There's your hope. And not only that, I've helped thousands of people do exactly the same thing.
mm.
So that's what we can talk about.
I mean, that's so awesome. I know I was reflecting on the fact that I have a Western medicine background, being an ICU nurse, and that, typically, obviously at the Lyme Disease Association, we can't give health advice, and I'm not a health advisor or qualified except to have my nursing degree. But um, when I look at where we triage people when people are coming to us for help, and that they basically in Australia right now don't get it in the doctor's office. I help them through some options and some questions and what's right for you, and some people do that very self-driven, and some people need extra help and reach out again. And when we had that discussion, we had the discussion about what's wrong with healthcare training and what the information and education doctors are getting. Never mind, we haven't even talked about the healthcare system, but doctors themselves have been taught in ways that's not helpful for chronic illness. And can you expand on that?
Yeah. Um, we expect our healthcare system to do something that it's not designed to do. Our healthcare care system is specifically designed and is very good at acute intervention. That's what we do well. Someone breaks a leg or blocks an artery or develops an acute infection like a pneumonia or preventing things like the plague and pox. We have things that can do that. We're exceptionally good at that. What we're not good at is managing chronic illness because how we approach chronic illness is the same way we approach acute problems. We try to manage chronic problems with acute intervention. In
Mm,
other words, we suppress the symptoms. We suppress the manifestations with drugs day by day by day by day, but we don't get to the root causes of the problem. And so people don't get well. And, chronic Lyme disease is a classic example of that. The proof of that is that the World Health Organization a couple of weeks ago defined that 70% of the world's population is chronically ill. 70%. People with chronic illness typically don't get well. The system is failing to manage chronic illness. But quite frankly, I've come around to appreciating that if you're looking to overcome chronic illness, and your goal is wellness, you're not going to find it in a doctor's office.
Mm.
It comes from inside of your body. And that's what you really have to know. And,
Well, I
and
was, go ahead.
and chronic Lyme disease is a really good example of that and a good model for us to talk about.
Well, because
Yeah.
I was saying to you that my previous belief was that my job was to triage, and some people would prefer to have a herbal approach, and some people would prefer to go down antibiotic approach. And in this discussion with you, you've corrected my thinking on that. Can you explain that to people and your thoughts?
About whether to do herbs or whether to do antibiotics.
Yeah, so that I was thinking that was a personal choice, and that people would want to choose go one way or the other. And you gave me some other ideas and some other education about that.
Sure. Well, antibiotics can be the right choice for someone who has an acute tick bite and they're acutely symptomatic. But antibiotics are not a good solution for chronic Lyme disease. And not only are they not a good solution for chronic Lyme disease, they don't work as well as people think they do for acute Lyme disease. It's the nature of the bacteria, and that's what's missing. Everybody treats the Lyme bacteria, Borrelia, and co-infections like they're aggressive pathogens. They're not. What they want to do, their mission, their life's goal, what they want is to persist in your body. That's all. And they don't have to make you acutely ill to do that. And they do it with very sophisticated mechanisms, but it makes them very, very different than other kinds of bacteria. And you really have to use the right tool to treat different kinds of pathogens. And that's the problem is that the infectious disease doctors know a lot more about Ebola virus than they do about the Lyme bacteria because they haven't paid attention to it. They don't study it. And because they don't understand it, they would rather ignore it and not recognize that chronic Lyme disease even exists. It's easier. If you don't have tools for something and you don't understand something, you really don't want to recognize that it even exists? But the fact of the matter is, these bacteria, the Lyme bacteria, have two very, very important mechanisms for persisting in the body. And this is really a very important key to understanding what chronic Lyme disease is. So when you get bitten by a tick that's carrying Borrelia or really any of the co-infections, what those bacteria are trying to do is get through your bloodstream and get to your tissues. All they want to do is persist inside your body. A normal host microbe relationship is for the microbe to be able to persist within the body without causing the host debilitating illness. So what happens what happens when you get bitten by the tick is it enters the body. The immune system knows this thing. It's on it really, really fast. But it uses two really important defense mechanisms to set up survival and persistence. The first one is it grows very, very slowly. All right. So suppose you get a virus, and on top of that, you get a pneumococcal bacteria that's invading your lungs. That bacteria has a very, very high growth rate. It is turning over. It is doubling itself every 20 minutes. What that means is somebody can get really sick really fast. And that's what antibiotics need to work, fast growth. Antibiotics work very well for that pneumococcal bacteria because it's turning over so rapidly and it kills it. And so, in several days to a week, the patient is getting well. It's overcoming that infection. Every 20 minutes, it doubles. 20 minutes. Borrelia, and this has been numerous studies. I just went through all the studies. I'm writing a proposal for a presentation that really catalogs all of this as an academic presentation. Borrelia turns over. It doubles every 12 to 24 hours in its most active stage. It's really, really slow. So it isn't affected by antibiotics the way that that pneumococcal bacteria is. But it's also a defense mechanism. And I've been looking for the evidence to really demonstrate this too. If something is really slow, it's not noticed by the immune system as readily. So it's a defense mechanism, so it's not recognized, it's not noticed. It can get through the bloodstream. So slow growth, that's really important. Second thing is it invades cells. All right. So we know that Borrelia can live inside and outside cells. And if in its active stage, when it's allowed, when it has an opportunity, it is outside cells breaking down tissues, tearing up our cartilage, and that's what's causing symptoms. But it needs insurance. It wants insurance that it can persist in the body. So what it does is it invades cells. It invades brain cells. It invades heart cells. It invades joint cells, chondrocytes. It invades different cells throughout the body. And when it invades the cell, if the cell is healthy, so, if a healthy cell is a hostile environment, cells have a process. It's not just your immune system that protects you. Your cells actually have a defense mechanism called autophagy that can destroy microbes. So a healthy cell is a hostile environment for the microbes. So part of its strategy is it bypasses those defense mechanisms within the cell, but it's still a hostile environment if it's active, so it can slow its growth so slow or even go dormant that it can just exist within the cell as long as it wants to. And this is very common defense mechanisms among microbes. I found a study that showed that estimated that 60% of the world's microbes at any given point in time are in a dormant state because it's really effective. If your environment is hostile, you just go dormant and hang out until you have an opportunity. And that's exactly what they do. So that's why so really, when people get that initial infection, so many people with chronic Lyme disease don't remember the tick bite like me because they didn't get sick. So a lot of times that initial infection occurs without people even knowing it. It's not enough to even get their attention. This is all happening. And that bacteria has seeded the whole body. It even invades immune cells, which allows it to manipulate the immune system. So, what this does, and this is really key, this is really, really important. What it does is it creates a reservoir of protected bacteria because the immune system can't kill it inside cells and antibiotics don't get to it in cells, especially if it's in a dormant state. So what happens is even after your immune system is cleared or you took antibiotics, you were symptomatic, you took antibiotics after the tick bite, clears all the active bacteria, but that reservoir is there. And you're not symptomatic anymore and you keep right on going like I did. And so this reservoir of bacteria. So this occurs with Borrelia, but I've also been able to document it for the co-infections, Babesia, Bartonella. You know, Babesia is a protozoa. Often it gets compared to malaria, and we use a lot of malaria drugs to kill Babesia. Malaria has explosive growth. Babesia grows at a snail's pace, just like Borrelia. And these drugs don't get it. And it invades cells. And it likes other cells, liver cells, cells that line blood vessels. So red blood cells. So it can stay dormant. And I've demonstrated this for the Babesia and Bartonella that both of those microbes can invade red blood cells. And normally, if they grew fast enough, they would just explode the cell. But and that's how the immune system sees them, picks them up, and gets rid of them. So they can slow their growth so they don't destroy the red blood cell and they can just hang out there. Mycoplasma, chlamydia, viruses, lots and lots of microbes use intracellular slow growth to persist inside the body and create a reservoir within us. And we're fine till we get older. Stay up all night over and over, over and over. Become stressed. Don't eat the right diet. Get exposed to chronic exposure to toxic substances. Man, we're all hammered with it all the time now with petrochemicals in the environment. Mold, that's a common one, I'm sure, in Australia. Not moving enough. It adds up. And then as we age, so what we see a lot of times is people crash in their late 40s, like I did, when they were trying to do what they were doing in their 30s and their body wasn't tolerating it anymore, or kids, which are very vulnerable because they're building out cells, their immune system is developing, and they get hit hard too. So when your body is stressed, when your cells are stressed, when the cells containing the microbes are stressed, then they can't contain those microbes anymore. The microbes reactivate, they awaken, they emerge, then they become active, they start invading tissues, and when they invade tissues, we develop symptomatic illness. I have a point called that I call the boiling point. And the boiling point is when you have enough cellular stress that causes enough microbe reactivation that it's driving further cellular stress and driving more microbe reactivation. And then it becomes a vicious cycle that's really, really hard to break. The only way to break it, the only way to break it is simultaneously suppress the microbes without causing additional cellular stress. There are no current therapies used by the medical system, antibiotics, ozone, hyperthermia, anything else that can do that. The only thing that on earth that I found that can do that is herbal therapy. Yeah, so that's what chronic Lyme disease is.
Yeah, it's huge. And, so many people have multiple pathogens and then some that, unknown, like the testing doesn't cover all the potential pathogens that any tick would have globally. I know definitely not in Australia. Was that true globally or is
Yep.
that?
Yep. It's there are lots and lots of things, and it's not just tick-borne things. We pick up things throughout our lifetime.
Yeah.
And it's not just chronic Lyme disease. So if you understand what I just told you and accept that that's a mechanism for causing chronic illness, you have accepted a model for how all chronic illnesses potentially
Mm.
exist. You look at multiple sclerosis. A lot of people with multiple sclerosis, most of them are carrying Borrelia. And it has been found that Borrelia scavenges the myelin and also chlamydia, mycoplasmas, others. And really the only difference between chronic Lyme disease with neurological symptoms and MS is the MS people are sicker and it's a clinician's right decision. But I'm finding this same mechanisms of action happening in many chronic illness. different microbes because we all pick up different things. And as I said, Borrelia and Bartonella invade different cells in the body than I mean, Babesia and Bartonella invade different cells than Borrelia. So you have different microbes invading different cells in your body, but this reservoir of microbes is being referred to by some experts as the dormant blood and tissue microbiome. So it is, but it's a dormant reservoir for allowing these microbes to have a persistence to survive without necessarily making people sick until until a favorable opportunity comes along. And then once you get sick, it's hard to break that. But and it takes years of persistence. You have to, and that's the thing. You have to have suppression. You have to do microbial suppression for years and years until all the microbes are cleared and you restore cellular health. That's the only way. That is absolutely the only way to overcome this illness.
And so if someone's facing that decision now, like you probably walked this journey yourself. So what lifestyle and emotional and psychological and intellectual decisions did you have to make to draw a line in the sand that I can do this, that
Yeah.
there's
Yeah, we've been helping people with this. I built a company here in the United States to help people go through this process. So we've had, packages of herbal protocols for years, but this past year we just reached the conclusion that we had to do a lot more. So I really broke down what it takes to actually help someone recover. And so we created a program that's a 6 month program. And, the first, when you have someone that first comes through the door, their whole body is in total turmoil. They're all the cells in their body are being ravaged, and so there's a lot of stress going on inside. And what that does is it activates the fight or flight response. And so when you raise cortisol and you raise adrenaline, that keeps people from sleeping. It's like I even when I didn't have to go to the hospital, I still couldn't sleep. I lost my ability to sleep because my brain was on fire. It shuts down the gut. It blocks detoxification pathways. So one of the first things we do is help people with herbal protocols, relaxation techniques, and other mechanisms. So we spend 2 months just helping them short circuit that stress response so their body can open up to healing. It's really important to do that. We start out with some basic antimicrobials and herbs in a tincture but we don't want to overload them. We found that if we just threw the big guns at people right in the beginning, it just was too much for their system in a lot of cases. So we start really slow on the herbs. We really work on that sympathetic overactivity for a couple of months. And then once we get to that place, we spend a couple of months healing the gut and opening up detoxification pathways. And it's not until about that fourth or fifth month that we're really starting to add in the stronger antimicrobial herbs to enhance that healing pathway. And even then, I'll say that, in my case, it took 5 years for the body to completely heal. And you really have to keep that pressure on. Everybody thinks, I'll just go get this intense hyperthermia therapy, or I'll do, 6 months of antibiotics and just knock them all out and I'll be done. And most people are a wreck by the end of it. They might get better for a while, but it comes right back. What you have to do is long-term suppression. And you can't do that with antibiotics. Antibiotics are the wrong choice, the very wrong choice. The very thing that most Lyme doctors are using is exactly the wrong choice to treat this problem. Here's why. When you look at the slow growth And the fact that you're not killing that intracellular reservoir, you do have to keep that long-term suppression, but antibiotics are a really bad choice to do that. So antibiotics are a single chemical agent, and it's very potent. And so these are natural chemicals that either came from a fungus or a plant or a bacteria that have been potentiated and manipulated to be very, very potent killers. And they will kill something like a pneumococcal bacteria that's growing very fast very well. We need antibiotics for those kinds of things. We need to save them for those kinds of things. Because within 10 days, it starts disrupting your gut flora. So pneumococcal bacteria will kill pretty fast. Lyme bacteria are growing super slow, much slower than your normal flora in your gut. So you're hitting your gut flora a whole lot harder than you're hitting the bacteria that you're targeting. And so you disrupt the gut. And whether you use probiotics, it doesn't matter what you use, you're still going to do that. And it's still going to be a problem. But on top of that, you start generating antibiotic resistant pathogens. So the last antibiotic was made in 1985 when I graduated from medical school. We have no new antibiotics. They stopped making antibiotics because they're very expensive. It costs $2 billion to bring a drug to market. So they've shifted to drugs that suppress symptoms and suppress manifestations of illness, but don't actually make people well, so we can treat them for their whole lives and make lots and lots and lots of money off of them. So they don't make antibiotics anymore, and there are antibiotic resistant pathogens, superbugs, to every antibiotics that's ever been made. So every time somebody uses antibiotics for more than 10 days, they start generating, they not only suppress their good flora, they start generating antibiotic resistant pathogens in their body that can be much worse than the Lyme bacteria. But it's much bigger than that. Every time somebody makes a choice to do 6 months of antibiotic, they are contributing to a major worldwide problem of antibiotic resistant pathogens, which is actually a whole lot worse than Lyme disease. Right now, since the 1990s, 1 million people die of antibiotic resistant pathogens every single year. That's much worse than Lyme disease. And it's getting worse. It's growing every year, every year, every year, every year from overuse of antibiotics. So we need to save those antibiotics for fast-growing bacteria that will respond within 10 days and not pound people for months and months and months on end with these kinds of infections. Antibiotics are also toxic to cells and mitochondria. You cannot get well with things that are toxic to your cells. Simple as that. The difference in herbs is when you take an herb, you're taking the plant's defense system. It's not a single chemicals, it's hundreds or even thousands of chemicals that the plant is producing to kill bacteria that might threaten its cells. So when we take that plant, we're borrowing the plant's equivalent of an immune system. And there's intelligence there. So one thing that I noticed early on and saw as a phenomenon that has now been proven by science is that when you use an herb, it suppresses pathogens, but it doesn't kill normal flora. So it's not going to wreck your gut. It also, because it's not one chemical, it's hundreds or even thousands of chemicals, it doesn't generate antibiotic resistant pathogens. Really important. And it's not toxic to your cells. It actually protects your cells from free radicals, toxic substances, radiation, and a whole range of things. It's the cell's protection system, and we're using it. So what that means is you can use it for 6 months or 6 years. You can keep the pressure on. And it's going to kill only the active bacteria. It's not going to touch that reservoir. But by attrition, it's going to wear it down as they emerge and they kill it. Now, I'm not sure that you can completely eradicate all these pathogens from your tissues. And there's not really any way for us to know because we don't go chopping people that are healthy up to see what might be living in their cells. So, but I speculate that we're probably not. And that's one of the reasons I continue to take herbs today. But again, I've experienced some of the best health in my life over the past 15 years. I don't have most of the symptoms that most people have at age 68. And I've been using these herbs continually. Now, when we talk about herbs, there's a really wide range of herbs, all the way from culinary herbs that you put into food to plants that are very toxic or even poisonous. So here we're talking about a range of herbs that I call antimicrobial adaptogens that have a low potential for causing drug-like effects and side effects because they're not toxic to cells. Your primary thing that you're looking for are the cell protection properties and the antimicrobial properties so that these have a higher potential for people to take them long term. And so as your body recovers and your cells recover, you restore a state where your body can keep these things contained. Your cells can keep these things contained. So I don't take the volumes of herbs that I used to. But in addition to that, yeah, I had to change my diet and learn how to sleep again and get exercise back and clean up my environment and everything else, you know. But that if that is not built into your recovery program, then the chances of you getting well aren't that high.
And so, as part of, obviously, I'm thinking of who would be watching this at sometime down the track and listening and learning. Um, I can't do this by myself. So I know if this is attractive, this is making sense to someone, you have a system, a supportive system in place to where they don't have to have all this knowledge to get started. Would that be accurate?
That was a big part of what I do. For years I did consultations that I was talking to people all over the world, but you can't practice medicine across state lines or country lines. So I was just doing high-level health coaching, basically guiding people in what they should do. I've written several books. My latest one is Cellular Wellness Solution. There was one called Unlocking Lyme a couple of years ago that really goes through all of this information. I built the program. It is definitely available in the United States. The programmatic part of it would be available to anybody in the world. It is all in English, so it for folks that are happen to be in that place, then it definitely works. Um, Shipping products has been more challenging because it's because of tariffs and all the restrictions that were put in with COVID and everything. So it's kind of a crazy space. I mean, I have a long-term goal that I would love to be able to have products manufactured in Europe and Australia and Canada. But we're just not a big enough company for that yet. But that's a long-term goal because I know you folks in Australia are struggling with these same issues. But the point is, what you need the medical system for is helping you with acute intervention. Everybody needs to have their labs checked from every now and then, just like basic liver function and things like that. You need basic screening tests to make sure there aren't other things going on that do need immediate intervention. Some people will need medications to help with symptoms and to stabilize their system while they're getting well. But you should be able to get that from any provider, not a specialized provider. But as far as expecting the medical system or Lyme doctors or anybody else to heal you, they don't have that capacity. That's got to come from inside your body. To get over this, you must create a healing environment inside your body. And yeah, that support is really important. I mean, we've built a community. We have, within the community there, I do lessons and live sessions, and we have health coaches, and but that's the kind of support. That's what gets people well, is that kind of support, not and doctors' offices just aren't set up for that, right? So what's missing is in chronic illness is we don't get to the root causes of the problem. And so that's getting to root causes, defining the root causes of illness is well defined now. I started asking this question 20 years ago when I was struggling for chronic illness. And I realized all we were doing was treating the manifestations and symptoms of the chronic illness, but we weren't asking that question, why did the person get sick in the first place? And doctors still don't ask that question. I became a specialist at answering that question. Why did the person get sick? Sometimes it's a tick bite, but 90% it's not the tick bite. It's other kinds of stress factors. People have a perfect storm of stress that sends them to that boiling point. The microbes reactivate and they get sick. And once that thing is activated, it's really hard to get it under control. And again, doctors don't understand it. So they just throw drugs at it, but the drugs don't get to the root causes. And that's really important. It's all about cells. It's
So,
so
go ahead.
so your body is made of cells, right? Everything that happens in your body, whether it's your heart functioning, thyroid hormone being produced, skin and bones knitted together after an injury, it's all done by cells. And we think of the cells as made of units like a heart and a liver, but they're not. So the heart is a composite of billions of cells working in synergy. The smallest functional unit in the body is a cell, a living cell. And every cell in your body came from one cell when you were formed. One cell gave rise to every cell in your body. So every cell in your body is structurally similar. So you can think about your cells as little microscopic machines that have a job. And some cells, like in the heart, have to work to make that heart work. But different cells have different jobs. But they're all structurally similar. And like any machine, they have operating requirements. So when you look at the operating requirements of cells, and this is really the formula of wellness, they're just a handful of things that every cell needs. So every cell in the body needs specific nutrients, carbohydrates and fats to generate energy, proteins or amino acids to build proteins, which are the basic machinery of the cell, vitamins and minerals, which act as cofactors in the reactions that the cell is doing. Different cells need different nutrients, like our thyroid cells need iodine to make thyroid hormone. Our heart cells mainly burn fat. Our brain cells mainly burn carbohydrate. But if you're eating a whole food diet, you're giving all of your cells everything they need. So a whole food diet rich in vegetables is really the essential diet for someone recovering. Cells need a clean environment. And today, and one of the reasons that people are so chronically ill is because we are being bombarded with higher levels of toxic substances that are unnatural to our bodies than ever before in human history because of petroleum and coal use. And this is a big deal. Um, and, when I was born, there were only 3 billion people on Earth, and most of them didn't drive cars. Now we have 8 billion people, 2 billion cars, and all the energy it takes to feed and clothe and entertain all of those 8 billion people is pumping out an enormous amount of abnormal chemicals. And we're getting them in our air and our food and our water and everywhere else. You can avoid them. you can clean your environment up. You can filter your water, filter your air, eat organic food, and you'll probably eat better food in Australia than we do here in the United States. So that's really important. Stress is a big one. Your cells need downtime to recover. Now, some cells, like your heart cells, have to rest in between beats and recover in between beats, and that's why our heart cells are so vulnerable. But most of your cells need 8 hours of sleep to rebuild from working all day. And if you're doing 6.5 hours, which is average in America, you're starting your next day with a deficit that your cells haven't recovered from the day before. So they're in constant dysfunction. They haven't recovered, they haven't rebuilt, they're at a deficit all the time. Cells need good blood flow. Exercise does a lot of great things, but the most important thing that it does is it moves blood and lymph in the body. And that flushes toxic substances away from our cells and allows our cells to breathe. We're too sedentary. We're not moving enough. And, I reached a point that I couldn't move very much because my body was so inflamed. And so I did sauna, which is a good second to move blood. And then the microbe factor, microbes are our arch enemy. I mean, everything's got to eat, and we are food for microbes, and they're constantly trying to get in our body because, they need a host to survive. And, they do it certain ways. Some try to break down the door and beat us down. They're less common, but most of them are like Borrelia. All they want to do is get in, persist, hang around until they get an opportunity.
So, Dr. Rawls, I think this is very enlightening education for Australians today who are facing tick-borne illnesses. And, there's a solution here that can be very self-driven and with coaching if they reach out to Vital Plan. And then as a community, I guess we need to find solutions to shipping and consistent shipment. So I know there's lots of people that bring things in from overseas and have all kinds of creative ways, including bringing
Yeah.
um, all different places where they've worked away. So, if you're listening today, this makes sense. How can somebody learn about your program and see if they can work through the shipment program?
Yeah, if they want to learn about the program, go to rawlsmd.com/resources, and that'll bring up a page that will tell them about the program. Or they can go to vitalplan.com, either one of those places. And it's we've got a lot going on. At the at least they could join the free part of the community that there's no obligation for, and just kind of see what's going on. And I would encourage folks, I don't know when you're going to air this, but our super person, Liza, who is the moderator for our whole community, is doing a tick boot camp coming up in January, just to teach people all the fundamentals of why this is so important and bring them into the network so they can just see what's going on. So that's all free. Um, but the deeper program is very structured. It has an immense amount of support, and it's there's community. You're in there with peers of people at the same stage that you are. So we do it in stages that people go through in cohorts. So they're advancing at the same stage as the people that they're around. And we have mentors that have been through the whole program now and are in a better place that are coming back and helping to cheer people on. Plus, I've built an enormous amount of resources. It has a resource library, and there's plenty of opportunities to ask questions. I do live sessions all the time, and our health coaches are doing live sessions. Everybody gets three. In each stage of the program, everybody gets a health coaching call as part of the program. And some people choose to go on and do more calls with the health coaches. The health coaches in our program I've been working with for a decade. They know the stuff. They know all these principles. They know these things. And that's really important. So it's Yeah, so that's it's been a lot of work. I mean, you wouldn't believe how much work we've put into this thing in the past year, and I'm not finished yet. I'm going to just keep making it better and better, and I want to make it available to anybody worldwide that is struggling with this sort of thing, just because it's such a problem. And I'm a physician, and that gave me a leg up for being able to understand the science of thinking outside the box. There were a lot of things that they just didn't add up scientifically, and I wasn't willing to do them. What attracted me to herbs is that I could get science. I could understand how the chemistry of the plant was affecting the microbes, affecting our cells and our physiology. And I've been studying that for a decade. And again, I'm in the process of putting together an academic presentation that details the evidence behind everything that I've mentioned this evening and why it's so important that people start understanding it and why we should be looking to herbal therapy as a solution. So even if you can't get the products that we have here, I detail everything that you need in the books that I've written, and you can get those things in Australia. You might have to piecemeal it together, and it might take some work. Part of what we do is try to get really good products with high grade ingredients available just to take the work out of it. But you can do it. I did it. I mean, I had to order every single thing. I was ordering things from all over the country and all over the world. But it worked. Gave me my life back. And, you know, so it wasn't some procedure. It wasn't antibiotics. It wasn't some magical thing. It wasn't some therapy that that restored my health. It was persistently suppressing the microbes with herbs and doing everything in my power to enhance the cellular health in my body. And that gave me my life back. What healing is the ability of cells to recover from stress. There is an aging factor. We lose cells and our cells age and lose energy over time. So it gets harder as you age, but anybody at any age can get back more than you might expect. And we've had some senior folks do these programs and just do extraordinarily well. So it's available. I mean, there are a lot of great stuff out there.
Dr. Rawls, I'm sure that you've given Australians hope. And one of the things I want to highlight is how important it is to be in a community. So you've developed a community for people to walk through a pathway. And I think people have seen that in Australia as well. So if you're not connected, reach out. There are communities here. And if you're attracted to Dr. Rawls' pathway, then we'll give you the opportunity to reach out as well. So God bless
Yeah,
you. And what's in your
thank you.
heart to leave people with today? What would you like to finish with?
Just the fact that yeah, it's like when you look out there in the world and you hear about everybody talking about chronic Lyme disease, and there's a lot of false hope out there that they're pushing things that I don't think are actually going to help people, and people are hopeful that it's going to work because they're desperate. I'm trying to give people real hope of things that are work. They're actually proven by science. They've got a good scientific foundation. It's real hope, and it's real because I can give you the example of myself, but hundreds of more that of people that have taken responsibility. That's a big thing, and that's a tough one. You have to be accountable. You have to be proactive. You have to accept responsibility for your own health and accept that though you can use healthcare providers and health coaches and everybody around you, that healing must come from inside of your body. And if you are not the one that is active, and I think that's a big problem with so many programs out there, and quite frankly, our whole healthcare system, is the patient becomes a passive bystander in the process. And if you are a passive bystander in your recovery, your chances of getting well are much diminished. So be accountable, be proactive, take responsibility, grab the reins, and you can do this. And and the power is within you. And what is so fantastic is the people that actually do that, that grab the reins, that take responsibility, that become proactive and do the things that they need to do to restore the healing capacity of their body, become different. They become something that they were not before, and they would have never been had they not gone through that process. So that's a pretty fantastic thing is, you find things about yourself that you didn't know exist. You find that you have powers and strengths that you never imagined. And but you have to reach for them.
And as I'm listening to you, just in completion, ladies and gentlemen, boys and girls, it's the same as anything you go. Like you go to a sports coach, or you go to a business coach, or you go to, but we're not educated or invited into that as healthcare consumers. And this way, and to make those changes easier for 90% of people, easier to do in a team or with a coach or in a group, where you can
Yep,
support each other.
absolutely.
God bless you for setting that up, Dr. Rawls. Thank you so much for being so generous with your time today for Australia, and have a good rest of your evening.
Well, thank you for inviting me, Sharon. It's been a real pleasure.
Yeah, likewise. Thanks so much.